Hi and good day to everyone. For today, we're going to discuss the first topic on principles and strategies of teaching medical laboratory science. And when we talk about the subject or the course, Principles and Strategies of Teaching in Medical Laboratory Science, this course deals with the principles and the teaching and learning process and strategies, especially in health education, since we are in the allied health science, and this is focused on our field, medical laboratory science, and at the same time, the roles of a teacher. In that case, a teacher which is a licensed medical laboratory scientist or a licensed medical technologist in different work settings. It also includes different approaches that enhance critical thinking, clinical laboratory teaching and assessing, and also evaluating learning. So for this topic, we're going to have an introduction to health education. And as an overview, we have to look into the history of health education in the Philippine setting. So we started from albularyos to religious orders to now the licensed healthcare professionals. So during the time in which before the arrival of foreign colonizers, so we're talking about the Spaniards and the rest of the colonizers who have invaded our country, the Philippines had already a thriving system of traditional medicine led by lands, which are healers of both natural and spiritual illness back then in the barangay level. We also have albularios, which are named as white witches. We also have manghihilots, the traditional massage therapists, and other indigenous healers known for their depth knowledge of herbal medicine. They also have perform rather spiritual rituals and also folk remedies. And health education during this period was informal. So it's transmitted orally from one generation to another through apprenticeship. The emphasis was on herbal remedies. There are also performance of prayers, incantations, and rituals, which were seen as both preventive and curative measures during the pre-colonial period. Now, during the Spanish colonial period, religious orders like the Augustinians, Dominicans, and the Jesuits were instrumental in the establishment of hospitals and provision of basic health education, intertwining medical care and with religious teachings. In fact, in 1578, San Juan de Dios Hospital was founded, and also we have the Hospital de San Lazaro, which played a crucial role in advancing health education in the country. They trained local midwives and they provided also nurses with education regarding proper care to the sick. At the same time, since we're talking about religious order, there is an emphasis of the importance of sanitation, of hygiene, and Western medicine, introduction, in fact, of Western medicine, and blending this with Christian teachings. Therefore, since religious orders were prominent in health education during that time, it is expected, therefore, that information about health was disseminated through sermons, catechisms, and the work of missionaries who served as both spiritual and physical healers during that time. And now, as we go to further in the timeline of health education in the Philippines during the American colonial period in the early 20th century, it marked now a shift towards a formalized health education as they were able to introduce public health systems and establish medical schools, nursing programs, and other allied health related programs and public health education. And now, in the 21st century, the Philippines has seen a lot of immersion and integration of technologies in health education. So, for example, we already have e-learning platforms, telemedicine, in which through the use of telephone and other messaging apps, we could be able to communicate already in time or in real time rather with our physicians using these platforms. We also have mobile health applications, electronic records, etc. So there's really an integration of technology with health education in the 21st century. Aside from that, formal health education. It became part of the different curriculum in schools, universities, and colleges. There is public health campaigns that were launched to address different diseases, of course, which was spearheaded, or which is rather spearheaded by the health department agency of this country. At the same time, we already have different healthcare professionals like doctors, nurses, medical technologists, midwives, pharmacists that were, and all other allied health professionals that were trained in both clinical practice and public health education. That, of course, in public health education, we promote scientific approaches to disease prevention and treatment. So, as we try to look into the history of health education today, there is already a coexistence of traditional and modern healthcare practices in the country. While healthcare professionals are primary providers of medical care, many Filipinos still consult albularyo's for holistic and complementary treatments. We have different religious institutions that also continue to play a role in promoting health education, particularly in the underserved communities. So there is a coexistence of the past and the present health education systems, which is a sign of good integration of history and the present. Now, as we define the health education as per definition of World Health Organization, it actually features that health education is not limited to a single method or approach, and the fact that health education's primary goal is to enhance health outcomes. So, after providing information, after disseminating information, the primary goal is to make sure that this necessary information given to the general public or to certain individuals could enhance their health and could enhance their health outcomes in general. And also, health education aims to provide accurate and relevant information about health issues. That includes disease and prevention, also the promotion of healthy lifestyle, and the effective use of healthcare services. And beyond providing information, health education actually seeks to positively impact the individuals and groups' attitudes towards health, because you're not just letting them assimilate information, you're letting them be inspired of the new ways in order for them to cope with health. And lastly, it's also designed for not just individuals, but also the broader community, since the aim of health education is to address not just few the issue or the health issue of few individuals, rather the general public or the public as a whole. And now, if we talk about a good or an effective health educator, a good or effective health educator must possess three things. Number one is adaptability. If we say health educator must be adaptable, it means that he or she could be able to tailor the different teaching methods to the diverse learning environments and the evolving needs of the students or the learners. At the same time, health educators must also demonstrate inventiveness by developing innovative way to communicate complex medical concepts, because of the fact that when we say health education, we're not just dealing with people who have prior knowledge or who are in the allied health profession. Rather, we should put emphasis on health education to the general public. Therefore, since there are a lot of medical concepts that could be complex in nature in the study of medicine and allied health science, it's imperative that as health educators, we could be able to innovate ways in order for the general public to understand the different terminologies, the different concepts that we would want to introduce and educate to them. And lastly, is there is creativity. When we say creativity, this is very essential in health education, in fact, because in designing lessons, you should not just only inform but also inspire the students or the learners to apply their knowledge in real world setting, because that is the primary goal again of health education, to have an enhanced health outcome and not just merely informing the individuals regarding certain topics related to health. Now, on the process of health education actually provides tools for developing the physical rather, emotional, spiritual, and sound mental health. Therefore, when we talk about different types of health or forms of health, it means that health education is a comprehensive process that would equip individuals with the knowledge and skills needed to achieve overall well-being across the multiple dimensions of health or forms of health. And if we talk about the different forms of health, of course, we have the physical health, which deal with the anatomy and the physiology and also the pathophysiology of the body. We also have the emotional health, how we could be able to cope up with different stresses of life, the strain of reality, and the challenges of life. When we say mental health, how can an individual can make sound decisions and judgments, good judgments in coping up with different challenges or adversities in life. We also have social health, how we interact with other people, and also spiritual help. And this already recognizes the supernatural, that aside from us human beings, there is a presence of a higher being, which is considered the creator. So those are the different process of health education. And in the process of health education, we give emphasis on the different key aspects of the health education process. The first one is there should be a planned opportunity of learning guided by specific goals, objectives, activities, and evaluation criteria. So the question there is, why is there a need to establish goals or have specific goals, objectives, and evaluation criteria and activities as well? This will ensure that learning is targeted and measurable. Again, by having specific goals and other information that is needed in the planning of health education, we can ensure that learning is targeted and measurable. Therefore, if it's targeted and measurable, we help individuals or the learners acquire the knowledge and skills they need for better health. Aside from that, health education process actually occurs in a specific setting. So these environments provide a framework that would support the delivery of health educations tailored now to the audience needs. Aside from that, it is a program of events that introduces concept at appropriate learning levels. So this approach allows us for a gradual building of knowledge, okay, in which we try to make sure that in the program of events, we have to gauge on the prior or the previous learnings of the learners, in which we take into account the previous experiences and understanding, and from there we will start educating them. Aside from that, also in the key aspect of health education process, the process actually builds up upon what the learners already know, and we could reinforce, or if it's something that is good, we could debunk if it's negative, and also expand their understanding on health related topics. And as we have known, in health education rather, a crucial element is the interaction between the qualified educator and a learner. So it have to give emphasis that the educator should be someone who's licensed, someone who has the training for that specific health topic. Now, on the different purposes of health education, it only means that these six purposes, it means that health education actually promotes health and disease prevention by addressing overall well-being, by modifying behaviors, providing essential information, and advocating for healthy practices through culture or cultural, media, and technological channels. Because the purpose of health education, again, is to become a form of advocacy. And given that it is an advocacy, therefore, it gives platforms for us, especially healthcare professionals, to share our knowledge and our perceptions and even our skills regarding on how we prevent and other people, or how we cope up with the different health related topics, such as, for example, if is a presence of illness or diseases or comorbidity, etc. And now we focus on the types of health education. On the types of health education, we have to remember that there are at least three. The first one is biological. So we're talking about the educating or focusing the education or health education of individuals about the anatomy or the structure, the physiology, the function, and also the general maintenance of the body. On the number two, the health resources, this will involve now teaching people how to use services wisely, especially sensible use of health resources or healthcare resources. At the same time, in this, we include understanding health insurance, assessing or accessing rather medical facilities, and utilizing preventive measures. And lastly, society and environment. It only means that it involves educating individuals about the health implications of public policies, environmental conditions, and the societal norms. Now, in the dimension of health education, we have to note Hirschken have been able to describe four dimensions of what is educative process or four dimensions of the educative process. Number one is substantive or curricular dimension. In this first dimension, it focuses on the content of health education, what is taught, what is learned. It involves defining the subject matter, includes the key concepts, the facts, and the skills that students are expected to acquire. On the second one, on procedural or methodological dimension, it addresses now how to effectively deliver material, whether it be through lectures, discussions, hands-on activities, simulations, or multimedia sources, and other ways in which you could be able to deliver the information. And the challenge encountered usually is what's the most appropriate choice of method that we use or approach that we use in order for us to make sure that there is truly an attainment of the primary goal of health education, which is to enhance health outcome. And also, we have environmental or social dimension rather, and this dimension considers whether there are appropriate facilities and whether the learning experience meets the needs of the students and the objectives of the program. And lastly is your human relations dimension. From the word human relations, we're talking about the interpersonal relationships involving the teacher and the learner in the teaching and learning process. So there should be a good and professional rapport between the educator and the learner. Now, on the different aspects of health education, first one is behavioral science. So there is an incorporation of psychological predispositions, environmental influences, and social-cultural context. And this is crucial for designing health education because it effectively prompts behavior change and addresses individual society and societal health determinants. So in psychological predisposition, we're going to look or study their attitudes, knowledge, beliefs, and skills and experiences. For environmental reinforcement, we have the different communities that they are socializing with or they are with. For example, the family, the friends, authority figures, and associates. And lastly, also we have your sociocultural context. So sustained societal norms such as attitudes and behavior. And behavior change is the desired outcome of health education, a positive behavior change to be more specific. So these different determinants, behavioral determinants, are very crucial. The health educator and the recipients of healthcare. We also have public health because of the fact that we leverage on or public health data and statistics to ensure that health education is grounded in evidence. Again, health education as per the definition of World Health Organization is a combination of the learning experiences of the learner and at the same time incorporating it with the different health topics that should be given. And lastly is we have education. So effective teaching and learning strategies are fundamental in health education. So it plays a vital role in health education. Now, what is the importance of health education? Number one is to enhance knowledge awareness. Of course, when you are trying to educate other people, there would be assimilation of new information. Aside from that, there should also be an enhancement of information that they already know. Also, it promotes health, safety, and security of the people. It develops and improves the community resources. It also increases the productivity and the strength of character. There will also be disease prevention because they are already educated on the different health related topics, which will subsequently minimize the cost because if they're already trying to strategies to prevent them for having different kinds of illnesses, definitely there will be minimized cost and it could lead to cost efficiency. At the same time is at the end, after the health education and the different interventions that is made in the community, our aim is to make sure that the individuals and the communities are self-reliant already, that if ever that they may face certain situations such as health related issues, they already know how to cope up with their own, they already know how to become independent on their own without or with making sure that there will always be enhanced health outcomes. And in the change process, this is very difficult because we have to make sure that in the process of change, we have different steps. But aside from that, in the change process, school administrators and the educators or the faculty should see the need to familiarize with the current trends, issues, and practices related to both health and teaching process. Because of the fact that health education or any other professionals for that matter should undergo continuing professional development. That as we go further into our different works, we have to make sure that we are quite trained to handle different subject matters. For example, and in the process of change, we have to first perceive the need for change. Of course, change can only happen if there is at least one person who's observant and who would challenge the status quo. Aside from that, to initiate group discussion, to implement the change one step at a time. We cannot make band-aid solutions by creating changes that can happen only in one night or in one step, because basically in the change process it would take couple of steps to ensure that the end goal would be met, or would we in making sure that the end goal will be met. And lastly is to evaluate the overall results of the change process and make further adjustment. So after making sure that there is already a change process, there is already a start of health education, it does not end there. We have to make sure that we have to evaluate the overall results of the change process at the same time to make further adjustments if it is necessary. And in managing change, we have different strategies as well. The first one is thinking practice strategy. So there is already an assumption here that rational learners will engage with health education when presented with logical evidence-based information. And that's me giving emphasis on making sure that as educators later on, we don't see our learners as someone who's naive, someone who does not know anything about the health topic that you would want to discuss. Rather, we should consider them as rational beings that when they are engaged with health education and when they are presented with logical facts and evidence-based learnings and studies, they can understand the situation. Aside from that, we have interest and commitment strategy. So it leverages the social or the social-cultural norms to align health education with the learners, the values and interest, enhancing also their motivation and commitment to their works. At the same time, we also have power and self-discipline strategy in which we use authoritative measures and enforce compliance to ensure that our learners will follow health education derivative or directives rather and practices. And there are different barriers to change. The first one would be culture. So there are different traditional beliefs about health, such as, for example, reliance on the health remedies and faith healers over new form of medicine or modern medicine even during the 20th century, and up until now there can also be reluctancies on the different innovations. We also have demographics. When we talk about demographics, usually, for instance, rural areas with a high proportion rather of elderly populations may face challenges in implementing, for example, health education programs that are designed for younger generation or more tech-savvy individuals. Aside from that, we also have to consider the socioeconomic conditions and environmental circumstances of a certain individual or group. So the poverty and the lack of infrastructure in many parts of the country can limit their access to healthcare services. That would affect now their ability to promote and implement health changes or health education. And lastly, we also have the state of wellness and development. It means that in regions, for example, with high rates of malnutrition, and inadequate healthcare facilities and equipments, the existing poor health status can impede efforts to introduce and sustain new health education initiatives. So those are the different barriers to change, and based on the list of barriers, these are some examples that can be cited in which as for example, for home remedies, we use cure all ointments and traditional healing techniques also. And also we have supernatural healing, and also we have regulated drugs or medicines, and also the use of over-the-counter medicines. So that's the topic on health education, specifically in the introduction of health education. Thank you everyone for listening, and I hope that you have gauged knowledge and understanding with the topics that were provided to you.